Can I take ibuprofen while on semaglutide for diabetes or weight loss? There's no known direct drug-drug interaction between ibuprofen and semaglutide, but both can independently affect your gastrointestinal system, which means you need to be thoughtful about using them together. If you're taking semaglutide and dealing with pain, you might be wondering whether ibuprofen is safe to use. It's a question that comes up a lot, and the answer requires some nuance. Here's the good news. There's no known direct drug-drug interaction between semaglutide and ibuprofen, but that doesn't mean you can just take them together without thinking about it. Both medications affect your gastrointestinal system independently, and that's where you need to be careful. Let's talk about how these medications work. Semaglutide is a GLP-1 receptor agonist. It slows down gastric emptying, which means food stays in your stomach longer. This is part of how it works, but it also commonly causes nausea, vomiting, and abdominal discomfort, especially when you're first starting or adjusting your dose. Ibuprofen works differently. It inhibits QX enzymes to reduce pain and inflammation. But here's the catch. It can irritate your stomach lining and increase your risk of gastric ulcers and bleeding. This is true for all NSAIDs, not just ibuprofen. When you combine these two medications, you're not creating a dangerous chemical reaction, but you are potentially stacking gastrointestinal effects. If semaglutide is already making your stomach feel uncomfortable, adding ibuprofen could make things worse. And if you're prone to stomach issues, the combination might increase your risk of more serious problems like ulcers. Some people are at higher risk when taking NSAIDs. This includes patients over 65, anyone with a history of ulcers or gastrointestinal bleeding, people taking blood thinners, and those with certain kidney or heart conditions. If any of these apply to you, it's especially important to talk with your healthcare professional before using ibuprofen. So what should you do if you need pain relief while taking semaglutide? Research suggests that acetaminophen, also known as Tylenol, is generally the preferred first-line option. It has lower gastrointestinal and kidney risks compared to ibuprofen. Just be sure to use it only as directed and speak with your clinician if you have liver disease or drink alcohol regularly. If you do need to take ibuprofen, there are ways to reduce your risk. Use the lowest effective dose for the shortest time possible. Take it with food to help protect your stomach. Stay well hydrated. And if you need to use it for more than a few days, talk to your doctor about whether you need additional stomach protection. One more thing to keep in mind, if you take low-dose aspirin for heart protection, ibuprofen can interfere with that protective effect. Ask your healthcare professional or pharmacist about timing if you're taking both. If you're taking oral semaglutide, follow the label and your prescriber's instructions carefully for how and when to take it, as timing matters for how well it works. Let's talk about when you need to contact your doctor right away. Seek immediate medical attention if you notice black or tarry stools, blood in your vomit, or severe abdominal pain. These could be signs of gastrointestinal bleeding or other serious complications. Also watch for signs of pancreatitis, which can include severe pain in your upper abdomen that may radiate to your back. Even if you're not experiencing emergency symptoms, it's worth having a conversation with your healthcare provider about pain management. They can help you weigh the benefits and risks based on your specific health history and current medications. They might suggest alternatives you haven't considered or provide guidance on how to use ibuprofen more safely if it's the best option for your situation. Here's what to remember. There's no known direct interaction between semaglutide and ibuprofen, but both can affect your stomach and digestive system. Acetaminophen is usually a safer first choice for pain relief, and if you do use ibuprofen, use the lowest dose for the shortest time, take it with food, and stay hydrated. Always consult your healthcare professional before making changes to your medications or adding new ones, even over-the-counter pain relievers. They know your complete medical history and can give you personalized advice. Have you had to manage pain while taking semaglutide? Drop a comment and let us know what worked for you. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.